Hello and welcome to the fourth and final session of part of our Discover Series 2, which has focused on paediatric stoma care. Today we'll hear from Claire Bohr, a paediatric stoma and bowel management nurse at Bristol Children's Hospital, who will be exploring the psychosocial aspects in paediatric stoma care. Claire has been managing patients from the neonate to the young adult in both hospital and community settings in the Southwest for nearly 20 years, so offers us a wealth of knowledge and expertise regarding this specialist sphere of stoma care nursing. Claire is currently a committee member of the Paediatric Stoma Care Nurse Group, Paediatric Liaison for the Association of Stoma Care Nurses, as well as being the co-author for the Paediatric Stoma Care Global Best Practice Guidelines launched in 2019. Something perhaps you don't know about Claire is that since 2010, Claire has been supporting athletes with parasport, travelling to many international competitions, including the Paralympic Games in Rio 2016 and hopefully to the rescheduled 2021 Games in Tokyo this year. Claire is a regular presenter, both nationally and internationally, sharing her knowledge and expertise when caring for this cohort of patients. In this session, entitled No, I Am Really Fine, Exploring the Psychosocial Aspects in Paediatric Stoma Care, Claire will highlight some of the complexities surrounding this huge subject.
There are many papers published on the psychosocial effects of having a stoma in the adult population, but there's very little on how having a stoma affects the child, young adult, and their families. I can only speculate that research in paediatrics has to undergo more rigorous ethical and consensual consideration. Paediatric care very much involves all family members, with parents and carers having to make decisions in the child's treatment, which may have an impact on the child's quality of life in the future. Parents and family members form a bond with a growing unborn baby. With advanced technology, what was once a very blurred image, only identifiable by a trained sonographer, it's now possible to have a 4D image, which can give your unborn baby features that bring them to life before they are born. The impact on parents of the family members of having a baby who requires medical intervention should not be underestimated, especially if it was unexpected and they weren't prepared for it. They would have been planning on having a healthy baby for probably 9 months, and within hours, these plans would have been shattered. They will be physically separated from the baby, with bonding being threatened. Fear, anxiety, guilt, and anger are all emotions that they may express. They may experience similar emotions to grief, as they may be grieving for the healthy baby that they don't have. Premature babies, often the results of mother's medical complications, which may have threatened the life of both mother and baby. This will be traumatic for both parents and may affect the mother-baby relationship. These are the fears that some of the parents will have of having a baby born with a medical condition. Parents are expected to carry out procedures on their own babies or child that they had previously thought was only undertaken by health professionals. If the baby requires care in the NICU setting, the care will be carried out by the medical and nursing team, making parents feel very redundant and powerless and possibly causing negative feelings such as anxiety, depression, anger, and helplessness. As soon as the babies are stable, they should be encouraged to take on as much care as possible, encouraging them to assist with the stoma care, even if it's a planned reversal before the discharge. This will give the parents a sense of purpose, worth, and facilitate physical bonding. I would like to share with you an interview that I have undertaken with a mother who has recently had a child in that situation. Hi, Antonia.
Hello, hi.
Hi, I was just wondering, could you just give us just a quick rundown of why Noah had his stoma in the first place?
So Noah, on the 20-week scan when I was pregnant, they noticed that our baby had an echogenic bowel. We had various tests done, and it looked like it was just, there was no reason for it in the end, because we weren't CF carriers, and the test didn't turn anything up. But when he was born by C-section at 35 weeks and 3 days early, because I had vasa previa, which meant that if I went into spontaneous labour, he'd be in big difficulty. So when he was born, he went straight up to the NICU to have CPAP because he had some breathing difficulties. And on day 2, they noticed that his abdomen was distended, and he didn't pass meconium within 48 hours. So because he'd had this echogenic bowel, they were concerned about the possibility of Hirschsprung's disease. So what they did was they did some rectal washes, and they took him down to the Children's Hospital to do some contrast enemas. So he had 2 contrast enemas, and it looked like things were starting to happen. But on the third contrast enema, which is when he was 4 days old, there was a bowel perforation, which happened as a result of the contrast enema. So they brought him, so the surgeon came back up to NICU and told us what had happened. And she told us that he had to have emergency surgery at that point straight away, because of the risk of sepsis. And that was when we found out that he may need a colostomy bag as a result of the surgery that was going to happen. And this was something that at the time, really our concerns were about the surgery and the risk associated with the surgery, rather than the news about the stoma and the colostomy bag. That was kind of a secondary bit of information to what we were hearing.
And how did you feel while he was having his operation and immediately after his operation?
So the third contrast enema, when we spoke to the doctors that morning before he went down to the Children's Hospital to have the enema performed, it was looking like things were improving. It was looking like the meconium was passing through his bowel a little bit, so we were hopeful about what that day would bring. So when the surgeon came back up to the hospital and told us that there'd been a perforation and how serious that was, and that he'd need emergency surgery, that was the worst point in the whole kind of NICU journey that we had. We couldn't see him. He was down in another hospital, and we didn't know what the outcome of the operation was going to be. So at that point, my husband and I waited in the maternity ward, and the midwives kindly because of coronavirus, my husband shouldn't have been allowed onto the ward at that point, but they kindly let us stay in a room and wait for the outcome of that operation. But that was really upsetting and really stressful at that point, and we just wanted to get it sorted and over and done with as quickly as possible, because we were so concerned about the risks of sepsis, anything happening that could put him in a more dangerous situation.
You mentioned that it was stressful waiting. Can you remember any of the other emotions that you might have had around that time, or when he came back, and how did you deal with them?
It was good that we were together. We were able to be together, and throughout that whole period, we were kind of on autopilot a little bit. We were constantly being given information by different people. It wasn't always clear what we could expect. From day one, we were kind of listening to nurses and doctors and midwives, and they all they all had slightly different slants on the information that they were giving us. So we had to piece that together. So it was kind of, fortunately, we were both on the same page, my husband and I, and we kind of worked as a team really well in that time period. We've been together long enough to understand how each other cope with those kind of situations. And we both just, like I say, kind of go into autopilot, and we don't get overly emotional about things at the time. We just try to get as much information as possible and just get our heads down and get through it, really.
And when you found out that Noah did have a stoma, and you were going to have to learn how to deal with it, how did you cope with that, both of you?
So, like I said, at that point, it was all crisis, a crisis situation, and it was life or death, really, Noah. So finding out about the stoma was not our biggest concern at that point. My brother-in-law had bowel cancer, and he'd had a stoma, and I knew, it's possible to live with these things and they can be life-saving. So it didn't seem like a disaster that he had a stoma, and we had to work with that. And of course, in the hospital, in NICU, you have a huge amount of support from yourselves, the stoma nurses, and the NICU nurses, who help you to change the bags, and all of the kind of material that you need to do these things is on hand and available, and advice is there at the drop of a hat. So it didn't seem like a terrible thing at that point. But as things started to improve with him, obviously we realized that this is something that we had to deal with. And it was really good to have advice from qualified, really knowledgeable stoma nurses while we were there. And we felt like the support was good while we were there. But it's only when you get home, really, that you realize the enormity of the task, and it's your own responsibility, and it's something that you're not familiar with. And I'm not a particularly medical person in the scientist. My husband's quite good with medical things, but I'm really not. So yeah, it was when we got home that we kind of realized what we had to deal with, and that was when it became a little bit more stressful.
Do you think you've got any suggestions maybe that how you could have been supported any better, or any tips or suggestions from the stoma care nurses that will be watching this, for a mother or a family whose babies had to undergo emergency surgery and has had a formation of a stoma?
Like I said, we had information coming from everywhere, and I remember being told that the stoma nurses were going to come and talk us through it. And you kind of have these things in the back of your mind, and then they happen, and you just, like I say, you're sort of on autopilot. So it was really good that you kind of came in and you were friendly and smiley, and not kind of, you didn't give us too much information all at once. You kind of made it normal, which is what was really good with the NICU staff as well. Everybody was just really approachable and friendly, and didn't make it seem like it was this big terrible thing. And also what was good was I think you came twice or three times, well, in quite a short period of time, which I think is really important, because like I've said, you can't take in all of the information at once. It needs to be drip fed, really, and to be repeated. And also, I mean, there's things that we've learnt whilst being at home that you could have told us possibly while we were in the hospital, but I'm not sure we would have taken it in at that point anyway. Sometimes it's a matter of just doing it and getting your head around it as you do it, and having your phone numbers and email addresses available, and knowing that we can contact you is what we need, because we need to do it and then find out what the problems are, and then you be on hand to help us deal with them. So yeah, I guess we could have had all the information possible right from the start, but I don't think that's actually the right approach, because it's about learning as you go.
And do you think as soon as you got home, your emotions kicked in that maybe you'd been putting off while you were in hospital because there was so much going on, and it was a bit of a downfall of emotions when you arrived home?
I think that's going to be ongoing for quite a long time. I don't think it didn't suddenly happen when we got home, because I think we're still, you know, we've still got things to do. Actually we're fortunate. Noah's going to have a stoma reversal this month, so we don't feel like we're out of the woods yet. You know, we're still holding it together a little bit, and yeah, I think over the next year probably, and also dealing with a newborn we're both tired and it's hard. You know, he gets wind at night and that's stressful as well, without all of the stoma concerns. So yeah, I think it's going to be a gradual process of kind of letting it all sink in and coming out a little bit.
Thank you very much, Antonia, for sharing that with us, because I know that it is quite difficult recalling the time that you had and the emotions and what you went through. So I really do appreciate you sharing that with us. Thank you.
You're welcome.
Unlike with other children, crying isn't always a reliable pain indicator in babies. Crying is a baby's way of expressing their needs. The parents may become anxious that their child is in pain when the stoma bag is being changed or the stoma is touched. Reassurance for the parent is important to give them confidence that the procedure isn't painful. Parents will accomplish a successful training plan at different times. Babies will pick up on facial expressions, so encourage the parent to keep smiling and talk in a positive way to the child, even when they're feeling anxious. It's important for the parent to allocate time for the first bag change. You will have to work at the child's pace and gain their confidence. Playing with dolls, teddies, and books can support you to explain to the child and possibly to their siblings. Use simple explanations and be true in what you're explaining. They might just need a simple explanation, like because your bottom doesn't work properly, the doctors will make you a tummy bottom that the poo will come out of instead of your bottom. Give the child space and permission to cry if they're afraid, but ask the child to adopt a different reaction if it hurts. You can then stop when asked and give them a preset time to restart the procedure. This way, the child will feel in control. You will need your clinical judgment to take control of the procedure, as the parents will want to protect their child if they feel that they're anxious. Children should be encouraged to help with the change of the stoma bag and with all their stoma care. And there's no set age to start doing this. They should be encouraged as soon as they're ready to start participating for themselves. Ask the child to name the stoma, and this will help the child to form a personal connection with the stoma. And it can be used as a code name if discussing the stoma around other peers. Find out what cartoon characters the child likes and be creative and draw some on the bags. In early teenage years, children acquire autonomy. This will be lost for a while as the child learns how to care for their stoma. Before surgery, the child would have probably been independent, but post-operatively, they may require assistance with what is seen as personal care. Being honest with a teenager will gain their respect. If they ask a direct question about their condition, give them an honest answer. Explain what things may feel like. Never say it won't hurt, but be honest and explain how it may feel, and also reassure them that it will only be temporary. Gain the child's confidence. This may take several visits. They may be more open to speaking honestly if you can speak to them without their parents and carers being there. Children may feel that they have to protect their parents by hiding their fears and negative thoughts. Give them the opportunity to express their feelings. This can be done in many forms, like music, art, and writing. Make time to listen. Use learnt communication skills. Use open questions, positive body language, and don't interrupt. Silence doesn't always need to be filled. Reassure them that it's normal to have a mixture of positive and negative feelings. Don't make promises that it will be fine. Support them along the journey, and don't take anger personally. Use other sources that are available: the psychologist, the play therapist, and charities. Encourage the child and their parents to write a letter to no one. Only they have recovered from the operation their memories of how they felt physically and mentally before the surgery will fade. Suggest they write the list of the level of pain they had before, the impact on their day or their routine, and the restrictions it put on them, and their quality of life, and anything else that they felt was affected. They can put the letter somewhere safe and hopefully may never have to use it. But if they are having negative days, find the letter, have a read through it, and this will remind them and potentially their parents the reason why they had the surgery. Parents find it hard to treat their sick child as normal as possible. Returning to normal routines and maintaining levels of acceptable behaviour will help the child adjust back into normality. Listen to the child's fears and apprehensions. Social media can have a positive and a negative effects on the young adult. It can guide them to appropriate sites on the internet. Link them up with other children that have gone through similar experiences. Only they will be able to share what their real fears are. At this age, the child will be attending school, which may cause them anxiety and possible exposure to the fact that they have a stoma. From my own experience from research I've been undertaking, the main fear in children of this age group is bag leaking, placing it in the top 3 worst things that others may smell or the noise. Children felt that anxiety about possible stoma noise in the quiet exam room affected exam performance. I've helped to be part of a study that we undertook of the surgical team's perception of the issues that they think that are apparent to the child compared to the child's own psychological, social, and practical issues. These are some of the fears that the children shared with us. This table shows that out of 9 children that were questioned, they were asked their fears of having a stoma, and we asked them to rank them in their top worst 3. This was compared to the answers of the surgical team that you can see below. The results showed that the professionals focused more on the recognised surgical complications, and a leak to the surgeons meant a completely different type of leak to the children that we interviewed. On conclusion to the study, it showed that there was a discrepancy between professionals' understanding, current consent practices, and information provided and the reality for these children. A better understanding of the psychosocial issues faced by children undergoing a formation of a stoma could lead to more realistic preoperative counselling, which may in turn promote better coping mechanisms and the awareness of the importance of the professional psychological input. I would like to share with you an interview of a 14-year-old girl and her mother of the experiences and the psychological implications that they both faced when having a stoma. Could you just tell me, Lee, maybe the reason, just briefly, why your daughter had to have a formation of a stoma in the beginning?
Well, she had an acute onset of ulcerative colitis straight Crohn's, and went into hospital during COVID. Obviously, I was staying with her. She went through various treatments, steroids, different biological drugs, infusions over a period of about 6 weeks. None of it was quite working well enough, and then it became very apparent that she needed to go to surgery. So the decision was, I would say, it was a clear-cut decision that we had to go along with, really.
Can you remember how long it was in time in between being told that your daughter needed to have an operation and a stoma, and actually coming into hospital for that operation?
We discussed it early on, actually. So we, within the first sort of 2 weeks of being in hospital, the stoma nurse visited us, because I don't know why, I was just a bit, I don't really know why, because it wasn't actually being discussed, nothing surgical was being discussed at the time, but it was in my mind and I was worrying about it. And so we arranged, the consultant arranged for you to come and have a chat, and that was really helpful. So it actually happened probably a month earlier than we actually knew that it was definitely going to happen. So it was already something that had been discussed, which I think was very useful, actually.
So do you think it was about appropriate amount of time to give you and your daughter time to be able to prepare both mentally and physically for this time and for having a stoma?
Yes, because the stoma nurse brought some of the bags, and my daughter was able to just put them on for the night to see how they felt, or for however long she wanted, and have a read through of some different information from other teenagers who'd had them fitted, and just get your head around it. That it's not a terrible thing, and people still have a life, and I think it was really important, actually.
And how, as a mother, did you feel about having to sign that consent form, having to make that decision for your daughter to undergo that surgery and have a stoma?
Yeah, as I said earlier, it was an easy decision because we knew my daughter didn't have an alternative, and she was so unwell that she actually wanted to go to surgery, which was heartbreaking for me, because I suppose as an adult, what that really entails. And I was, I think that it was hard for me hearing from the surgical team. They run through everything, all the things that can go wrong. And so it's quite, even though they have to tell you those things, it's quite, it's really daunting. And I obviously had to hide my feelings from Fleur as well. So that, I couldn't really talk to, it's quite hard because the staff were amazing, I have to say, and I could talk to them, but I didn't want to burden Fleur with it, and she wasn't well. And obviously being COVID, I couldn't really see my husband that much either.
So you're saying that you needed an outlet for you to express your stress, not in front of your daughter. So do you think there maybe would have been a better way for the surgical team to have maybe approached that could have helped in any way?
I suppose it might have been nice to have a separate conversation with them before they spoke to Fleur, so that I didn't have that, so that then I could, because sometimes I wanted to ask questions that I might have not wanted to ask in front of my daughter. So that would have been helpful, but obviously everybody's under pressure and they haven't always got time to do those things, so it's a difficult one. But all the staff were really helpful, and in fact one of the student nurses caught me one day looking upset and had a chat, and she put something in place which was really lovely for Fleur to have a chat to another patient who'd had a similar operation. And so it was lovely, for Fleur to have an honest conversation with another teenager.
And do you think there was anything else that we could have done to have helped you and the rest of the family cope psychologically with the implications of your daughter having a bigger operation?
I don't think so. I think the whole team were really very good, actually. So and like I say, we were lucky that there was another person similar age who'd had the operation that was on the ward, and so that was fortunate for us that we had that opportunity. So that really helped, and we did actually have the opportunity to speak to the psychologist in the hospital and when we left, which was, it's just really nice to talk things through, because actually when you go back to normal life, it's that brings its challenges as well, doesn't it? And so it's actually quite nice to have somebody that you can just be honest with.
Not all hospitals are fortunate to have the support of a trained psychologist. So do you think it is something that you would said helped you get through and was an important part of the recovery for your daughter and you?
I don't think my daughter didn't find it particularly beneficial, but I'd booked one session in, and that was nice. I find actually that when I left and got back to a slightly more normality, that I used to get frustrated with people who were annoyed about the everyday things in life. And I suppose that's a very natural reaction, but I wasn't really noticing it myself.
Yeah.
And I suppose it was just I suppose I was just thinking, well, you've got nothing to moan about. But we were, I mean, I have to say the team were really, really supportive, and they were very good actually.
And so do you think there's any other suggestions of how you could have been supported better?
I suppose perhaps we could have had some more private conversation, but I think with COVID going on, it was quite difficult. There was a separate room you could go to, but that was quite tricky, because if there was somebody already in there with COVID, you couldn't really always be in somebody else's space. So maybe what would have perhaps been nice is having more contact with some of the other, although obviously you're looking after your child and concentrating on your child, perhaps being able to talk to some of the other parents might have actually been quite nice. And maybe in a different time, when it's not COVID, you might have had that more of an opportunity to do that.
Thank you ever so much for sharing that with us, because I know it's not easy sharing, talking about your emotions and sharing about your experience. So thank you very much for that, Lee. That's great. First of all, how did you feel when you were told that you might have to have a stoma?
Well, I was told like a month before, so that I wasn't actually going to have it, but it was a possibility. And then I was quite upset. And also I didn't know what a stoma was, so I was like really confused. But then you came in and told me, and then I was like, oh, okay, that sounds okay. And then the doctors came in one day and told me, oh, you have to have it. And then I felt like really overwhelmed. But I think then I realised like I wouldn't have to be in pain and like going to the toilet not thousands of times, 15 times a day. And then I was quite excited, yeah.
So did you do any looking up at the internet from about a month from when you were told that you potentially might need one to actually have it? Did you do your own bit of research?
I don't think I did. I found people on social media who had them, but that's it, I think. Yeah.
And did that help looking at that on social media?
Yeah, definitely, because I found loads of people in like their 20s with them who like talk about it openly, and it helped.
And were they talking about the physical aspect of it and how you manage it, or were they talking about, did anybody talk about their feelings and their fears about it?
They talked about both physical and mental, and answered people's questions, and just like had day-to-day life on their Instagram as well.
And after you had the stoma, you possibly had some negative days that you were feeling a bit down. How did you manage to cope with any negative days that you might have had?
I think mentally you just have to think like having a stoma, it isn't a bad thing, it's a good thing, because it's like, it just is, it's relieving you from your pain and like making, like letting you have a normal life and not having to worry about things. So I think I just think of that, and like what I just generally do is just relax, go on a walk and meet friends and stuff.
And have you told your friends about your stoma?
I've told, I think most of my friends know. Some of them I haven't told like everything about it, and then some of them I've told like everything and what I do and stuff.
And were you a little bit apprehensive before telling them of what they might think?
No, I think for some of them I was, but after I told them they were fine.
They took it in their stride.
Yeah.
And do you think you were given enough information by either the stoma nurse team or the surgical team before you had the stoma about the practical side and the psychological side?
Yeah, definitely. I think maybe for what would happen after on like the surgical side, I wasn't told enough, but except from that, yeah, I was told enough.
And your mum mentioned that you actually met another young lady while you were in hospital who had just had the same surgery as you, but was a few days ahead. And she said that helped you a lot. So would you think that would help anybody else in the future, that maybe you could talk to them and you could repay that and talk to somebody else that may help?
Yeah, it definitely helped me. Like I still speak to her now and it helps. We just talk about how everything is and stuff. So it definitely is helpful having someone in the same position as you.
And do you think you could share, there was anybody that you could open up to your feelings and your fears? Because opening up to your parents, sometimes you feel that you want to protect them. Did you have the opportunity to open up to anybody else?
I think I mostly just spoke to my mom because we were in there for ages, so we were really close then.
Yeah.
Not really. I didn't really speak to any of my friends loads about it, but yeah.
And what was the best piece of advice, do you think, you were given of how to cope with having a stoma?
Don't let it control your life. Yeah.
Excellent. Did you find having somebody professionally, a psychologist to talk to, did you find that helpful?
At the time, I didn't really think I needed it, so I didn't have any sessions with her. But when she came in to check on me, I found it helpful, yeah.
Excellent. Thank you ever so much for talking. I know it's not easy always talking about your feelings and your thoughts and your experiences, but you are a strong person and you're very strong-willed. So I think you managed to get through it by being in control, like you said.
Yeah, thanks.
Thanks ever so much. Finally, these were the references that I used for this presentation, and I would like to thank you for listening and taking part of this presentation of an emotional subject that we don't always look that deeply into.
Thank you, Claire, and thank you to all your wonderful patients for sharing some of their most personal thoughts and feelings when faced with the prospect of stoma formation. Listening to Antonia express her emotions so clearly when her newly born baby boy was so sick was really quite powerful, as well as hearing from the beautiful 14-year-old young lady who so articulately expressed her emotions and feelings towards having her stoma. Truly inspirational. And wasn't it interesting to see the results from Claire's research study, highlighting that sometimes our perceptions as healthcare professionals on what we think our patients may struggle to come to terms with is often so far from reality? Well, I hope you have found all 4 sessions in this second Discover series brought to you from Salts Healthcare interesting and informative. If you would like to watch any of them again, All sessions are available to watch on demand at the SALTS Healthcare website. If anyone has any follow-up questions, then we would love to hear from you. Please do email us at discover@salts.co.uk and also use the same email address and complete the evaluation form to receive your certificate of attendance. A big thank you to all of our speakers for providing such valuable and important insight across each and every episode, and of course to you, our audience, for taking the time to watch and feedback on the sessions brought to you by SALTS Healthcare.